In examination of facial nerve, the first thing we look is wrinkling on forehead to look for the frontalis muscle. So in a normal person, when we ask the patient to raise the eyebrows, we see the wrinkling is present on the forehead. Whereas in a patient with facial nerve palsy, when we ask them to raise the eyebrows, we notice that there is lack of wrinkling on the affected side, whereas on the normal side, the wrinkling on the forehead is present. The second thing is we ask the person to close the eyes. In normal person will be able to close both the eyes tightly. Whereas in a person with facial nerve palsy, person will not be able to close the eye on the affected side, whereas the eyelid is closed on the normal side. So this is the second examination. Third is we look for Bell's phenomenon. As we already discussed, on the affected side, the eyelid will not close, because of which we see that the eyeball is moving upwards and outwards. This upward and outward movement of the eyeball is called as Bell's phenomenon. Next we look at the nasolabial fold. So here this is the normal side. We see that nasolabial fold is very prominent. This is the affected half of the face. We see that there is nasolabial fold is less prominent. So this is called as effacement of the nasolabial fold. Next, we ask the person to puff the cheeks to look for the buccinator muscle. In a normal person, when the person puffs the cheeks, there is air and he can hold it. Whereas in a person with facial nerve palsy, on the normal side, patient is able to puff and hold on. Whereas on the affected side, if you see, there is leakage of air from the mouth and there is flattening of the cheek on the affected side. Next, we ask the person to clench the teeth and we look for the deviation. So here if you see, this is a normal person. When he's clenching the teeth, there is angle of the mouth is both are at the same level. Whereas in a patient with seventh nerve palsy, when he clenches his teeth, we notice that the angle of the mouth is getting deviated to the normal side. This is the normal side and this is the affected side. So the angle of the mouth gets deviated to the normal side. And the last test which we do is look for the taste sensation from the anterior two-third of the tongue to look for the sensory functions of the facial nerve.